I'm Lynn Faulds Wood, and I want to thank you for watching this. Now, you're probably watching because your doctor has recommended that you have an internal investigation called a colonoscopy. First, let me reassure you, many thousands of people a year have colonoscopies, and most of them don't have cancer. I'm about to have my colonoscopy, and you'll be able to see exactly what's involved. I'd like to talk to you about the thousands of people who've lost money to your husband's companies. You might remember me from the BBC's Watchdog programme. It was while I was presenting that programme, I was diagnosed out of the blue with advanced bowel cancer. Don't kick me.
You're trespassing.
You're squashing me. It was just a few weeks after this photograph was taken that I got the shock diagnosis. My son was just 3 years old. It was a devastating time for us. Luckily, I survived, and I've been campaigning to raise awareness of bowel cancer ever since. Every 5 years, I have colonoscopies to make sure the cancer hasn't come back. I'm having my colonoscopy here at St George's in South London, a centre of excellence for the NHS bowel cancer screening programme and my local big hospital. Units like this handle thousands of patients every year. Some are here because they have symptoms, some because of family history, and some for the bowel cancer screening programme. But many people are not really sure what their bowels are and what they do. We use the word bowel when we want to talk about this important part of our body's food processing system. There's the small bowel or intestine, and then the large bowel or colon, which is where the word colonoscopy comes from. And down at your bottom, there's the rectum. Most cancers are in the lower colon or rectum. Bowel cancer is the second commonest cancer. Colonoscopy is a really effective way of finding it by looking inside our bodies for small wart-like growths, they're called polyps, which can turn to cancer. And colonoscopy works best if we help it. Now, it's really important that you clean out your insides so they get a clear view of the walls of your gut. And to do that, all the hospitals will send you a really helpful fact sheet with things like what you can eat the day before, breakfast of white toast, tea, coffee, no milk, that sort of thing, what clear liquids you can drink. They'll also send you laxatives, and you take some the night before and some on the day. And it's really important that you take it all. I'm about to have mine. Doesn't exactly taste pleasant, but we've got to do it. On the day of your colonoscopy, you won't be able to eat anything. I was already really hungry, but I got here early so I could have a quick chat with the specialist, Roger Lester. So, what is a colonoscope and what does it do?
Okay, a colonoscope is, as the name suggests, an instrument for looking into the bowel or the colon. It's about the same, slightly smaller diameter than my finger, very long, because the colon is about 1 metre long, and we have 1.5 metres, which gives us the length to get around the whole colon.
And bendy.
It's bendy to go around the bends, and we can manipulate the tip of the instrument with these two wheels. And ultimately, we aim to go around a colon with that kind of length.
People think this is painful.
It shouldn't be painful, as long as the colonoscopist is well trained. And effectively, you are moving somebody's colon. It feels uncomfortable. It should not be painful. It's slightly uncomfortable because your bowel is basically rotated by using this instrument, but it shouldn't be painful.
Let's hope so.
Lynn Faulds Wood, please.
That's me. Thank you very much.
Hello, my name's Beth and I'm one of the nurses. I'm going to be admitting you today.
Thank you very much.
So you just want to follow me down here. We're going to go to room number 1.
I'm here for a checkup because I've already had bowel cancer. You might be having your colonoscopy because of the NHS screening programme or because you've been referred by your GP.
And then we'll get you changed and Mr Lester will come and have a chat with you. So
Lovely.
come on in here.
Thank you very much.
And just take a seat for me.
Thank you.
Thank you. Okay. Probably going to give you a little bit of sedation today.
I'd like some.
I was going to say most people do. In order to give you that, we're going to need to pop a needle either into your hand or your arm, and we'll probably do this in the procedure room today. Are you all right with needles?
Very happy.
Fine. So
The nurse will ask you if you have any medical problems which might affect the procedure and if you're on any medication. She'll also want to know what you've eaten or drunk within the last 24 hours.
And last time you had something to drink?
About 3 hours ago.
Okay. So that would have been about lunchtime, 12-ish. Was it water?
Water, just water. I've only had
Lovely.
water this morning.
Fine. What I'm going to do now is I'm going to ask you to get changed into one of our lovely hospital gowns. I'm sure you've seen one of these before, quite often. So we've got a bag in there for all your belongings and a pair of shorts just to keep your modesty protected.
Lovely.
Okay. So when you're ready, I'll come back and check your blood pressure.
Lovely.
All right. Thank you very much.
Thanks very much. I don't think you're going to be watching this.
Before the specialist Roger Lester does the colonoscopy, there are a few formalities.
Hello.
Lynn, how are we doing? All right.
Waiting in eager anticipation.
So we went through this already, what we're
Yeah.
going to do. So effectively colonoscopy, if we find any polyps, we'll take them out.
Yeah.
The hospital needs your consent for any kind of procedure, including colonoscopy. And your doctor will want to talk to you and deal with any worries you might have.
Yeah, fitness-wise, no problems at all.
I've had this before, but lots of people are frightened and nervous about having it done. What would you say to them?
Well, I think most people are frightened about what the result's going to be. Okay, they're frightened about the procedure, they don't know what it involves, but they're particularly frightened because they think they may have cancer. And why do they think they're going to have cancer? Even young people, because they know somebody who's had cancer. How is it found? Endoscopy. So they automatically assume, my doctor said I need an endoscopy, I think he suspects cancer. In reality, less than 10% of people do end up having cancer. Many of them will have polyps or they'll have colitis, which is treatable. We can take polyps out and actually prevent cancer. So the total number having is small.
Take a seat on here for me.
Here I am, this is it. Now we'll see if I've got any problems since my last colonoscopy 5 years ago. It's natural to be worried, but I know I'm in the right place if there is a problem.
Is that all right? Is that comfortable?
Yes, fine.
Before the colonoscopy, you'll be given an oxygen supply and something called a cannula will be inserted into your arm so you can be given sedation.
Feel like you've had a couple of glasses of wine, really, just nicely relaxed.
It won't normally put you to sleep, but you might feel a bit woozy.
Can I have the wine instead?
Yes, it's basically a combination of a little bit of pain relief and what we call an anxiolytic, which reduces your anxiety. Okay, your oxygen level is absolutely fine.
Good.
You can watch yourself on the screen.
Stop on the screen there.
Yeah.
And as we go around, if you see things and you think, oh, what's that? Just
Yeah.
feel free to ask and we'll...
There's a little bit of air going in there, but you will feel it moving around a little bit inside you.
Yeah.
You've done a great job with your preparation, it's nice and clear.
That's because I stopped putting food
You took care.
yesterday morning and I was...
Yeah,
By now, you'll hear I am feeling woozy.
you've really done really well with this prep. It's absolutely perfect.
It's not troubling at all. I can't feel anything unpleasant.
Good.
The trouble is, any problems are buried deep in the body, and this is the best way to go fishing for them.
So I'm just looking for the way through here. And there it is.
Most polyps you find don't turn out to be cancerous.
No, the vast majority are not. In fact, the most common kind of polyp has no relation to cancer at all. And the ones that do are related to cancer, by removing those, it actually prevents cancer. So take a little bit more of that fluid out
Yeah.
there.
That's the black coffee I had earlier.
Right, okay.
So marks out of 10 so far for using the prep properly.
Oh, 12.
12, good.
Yeah.
You know what, I can feel you up here
Yeah.
somewhere. Are you up here already?
I've actually just turned your colon
Yeah.
there by
And
turning
that-
this round.
It's a kind of, almost a kind of tickling sensation.
Yeah. And I think we're coming up probably to the last turn.
So that was really quick. He's got right round the question mark shape towards the end.
Yeah, we're coming to the end now. So what I'm going to do now is to come back very slowly. I want to look at every single centimetre of this bowel.
How long should a colonoscopy take on the way in and the way out?
It varies. I think the important thing on the way out is, I think there's no specific time, but that you look at every single bit, and on average it takes between 5 and 6 minutes coming out. And maybe there's a little polyp there, perhaps.
Really?
Yeah, I think there probably is. So we just have a little look. But this is tiny. Remember, this is magnified.
Yeah.
25, 30 times. Okay,
so actually
very
you're
small.
looking at a real little tiny bit of my bowel.
2 millimetres, if,
Yeah.
at the most. And that looks as though there's a small polyp.
So is that on the bottom of the screen now a little flat bump?
Yeah. And if you
Which
look, when I
could
turn
turn
this,
into a polyp?
yeah, I think it is a little flat polyp.
If they do find a small growth, as they have done with me, they may want to take it out so it can be investigated. They do this by inserting a wire down the colonoscopy tube and removing the polyp.
Open again, sorry. Close. See, that's completely taken the whole lot.
Yeah.
Again, you won't feel this. I'm just going to tug this away. You won't feel that. And that's the polyp gone completely.
Yeah.
Because the whole idea is that cancer is completely preventable. If you take polyps out, you prevent cancer. And it takes, as I said, that 10 years to go from nothing to a cancer. It's a very preventable disease.
Yeah.
Okay, let's take that air out for you now. So that's excellent.
Yep. A little bit.
But I think bearing in mind the fact, as I said, it takes 10 years to go from nothing from polyp to cancer,
It feels great.
you're not going to have any problems at all.
Thank you very much. That was so easy. Not for you, but
Not
for
painful.
me. It wasn't. It was very comfortable. Not a problem.
Good.
And having no problems, having found that there's no cancer lurking in there. That's great. Thank you
because I
very
think
much.
even people like yourself, you think, well, is it going to be all right? Because you've always got that fear.
Yeah.
But it's fine. It's
Yeah,
great.
lovely.
Good.
Thank you very much.
I think we live to 100.
I'd like to.
Absolutely. We'll do your colonoscopy at on your 99th birthday or something.
Thank you
How's
very
that?
much.
What we're going to do now, we're going to
Okay.
now take you out into recovery.
Lovely.
Okay.
Thank you so much.
Very welcome.
Yep.
Once the doctor has finished, you'll be taken to a recovery ward where you can get over the effects of the sedation and where the nurses can keep an eye on you to see that everything is okay.
So what we're going to do is we're going to pop your oxygen back on.
I'm going to put this on your arm.
All right.
Blood pressure.
Thank you.
We'll just keep you here for about 45 minutes or so,
Yeah.
just to track your progress on the recovery.
Lovely.
You'll be glad of the rest. The only problem is it means waiting a bit longer before you can have anything to eat or drink. Oh, and since we filmed my colonoscopy, I've got the report on the polyp they found, and just as Roger Lester said, it was nothing to worry about. Well, my colonoscopy was good news, and I'm now having a lovely cup of tea. I'm feeling a bit woozy. I'm glad I've got somebody to drive me home. But if you're told that you need a colonoscopy, I hope you're now feeling reassured. You don't need to be nervous or frightened. Most of them turn out not to be cancer. And I wish you a long and very healthy life.